Tonight, we have a special bigger picture discussion on health care in America, with an increasing number of Republicans in Congress acknowledging that Obamacare is here to stay. And with President Obama winning re-election, it certainly seems that Obamacare, as Speaker of the House Boehner put it, is the law of the land. And with Obamacare, millions of Americans will have unprecedented access to affordable health care, many of them for the first time. But while the upshots of Obamacare seem clear, the details and fine print of the law are hazy at best. Tonight, we'll get down to the nitty-gritty of Obamacare and answer the pressing questions that Americans on both sides of the aisle are asking about President Obama's signature legislation. Joining me for the discussion tonight are Ethan Rome, Executive Director of Healthcare for America Now, Karen Davenport, Director of Health Policy with the National Women's Law Center, and Ron Pollack, Executive Director of Families USA. Thank you all for joining me tonight. Great to have you all with me. First of all, just a general question I'd like to toss out to all three of you. One of the big problems with healthcare in the United States seems to be affordability. Part of that is that health insurance companies have been skimming 20, 30, 40% off the top for a long time, for-profit hospitals and everything else. Is healthcare in America going to get more affordable? Let me start with you, Ron.
Well, it is going to be more affordable, and for individuals and families, one of the things that people are going to really value is that people are going to get tax credit subsidies to make coverage more affordable. So when people go into these new marketplaces called exchanges, and they purchase insurance through these exchanges, a very substantial portion are going to get significant tax credit subsidies, and that'll mean the premiums that they have to pay out of pocket will be considerably lower. Now, you mentioned before that insurers often take a fair amount of money for marketing, advertising, agents' fees.
CEOs making $1 billion.
CEO compensation and profits. You know, that's actually being significantly regulated. Now insurers have to spend at least 80 cents out of the dollar, and the larger plans 85 cents out of the dollar in actual health care for people. So that's a big deal. And by the way, any plan that fails to do that has to pay rebates to those people who've enrolled. And there are over $1 billion in rebates that have been paid already this year.
Right. So Karen, we spend about twice as much as any other country in the developed world, the OECD nations, on health care on a per capita basis. And our results are not that different from the more well-developed countries. Are we going to see not just the individual affordability that Ron was talking about, but affordability, costs under control in this system?
I think we will. One of the really unheralded parts of Obamacare is the investments that it makes in improving the value of what we get for our healthcare dollar. A lot of that starts with the Medicare program, which is a place where the federal government makes the payments to physicians and hospitals and is able to really experiment with that. But I think we'll see that spread into private insurance and employment-based insurance in not too long a time. One thing I want to add to what Ron said about affordability, also one of the real achievements of the Affordable Care Act also is that women will no longer be paying more for the same health care that men purchase.
Right. Being female is no longer a pre-existing condition.
That's exactly right. Being a woman is no longer a pre-existing condition, and right now women pay 20% or more for the same policy that men can purchase in the individual market.
20%? The spread is that large?
It can be more than that, too. It depends on the state. But right now women are paying about $1 billion more in premiums every year compared to men for the same coverage, and that will no longer be allowed as the law comes into place.
That's a good and healthy thing, it seems. Your thoughts on this, Ethan?
I mean, I think, one of the things that this law does is it eliminates discrimination against people with health care conditions.
Right.
It's one of the most outrageous things about health care in our country is if you purchase insurance and if you actually need it, they drop you. Right. They won't sell you the policy. They'll charge you more. This law eliminates that. It ends insurance discrimination. It ends abuses of insurance consumers. And what it does do is it puts us on a path to focus more on healthcare outcomes instead of debate about healthcare financing. We can talk about getting people more healthier instead of people going through medical bankruptcy. So that's what makes this law so significant, is that it does make healthcare affordable for businesses, for families, and it changes the complete landscape of the healthcare market.
My sense of this law is that this is very much a starting point, that we may be just a little behind the curve. The Saskatchewan hit back, a generation, 2 generations ago, when they went with a single-payer health care system, and then the other states across, or the other provinces across Canada said, hey, wait a minute, me too. I'm curious from each of you, your sense of, is this a beginning point, or is this something that, 20 years from now is still going to be in place pretty much as it is?
I mean, every national reform that we've had in this country of any kind, whether a civil right or a program, has had to be perfected and is still being perfected. But so this is a first step, but it's an extraordinary first step, and it makes implementation such a priority. I mean, in the next 24 months, all of these things come online. People get insurance, people get subsidies, and so that's why it's so important for governors to stand down from their politics and stop being partisan about this law. It's the law of the land, and we all need to come together to make it a reality for everyone.
Well, Karen, speaking of the governors being partisan, we have a handful now of Republican governors who have, it's a growing handful, maybe it's 2 handfuls, who are explicitly coming out and saying, no, we're not going to do the exchanges in our state. And there's one body of thought that suggests that by saying that, basically, the federal government, they're going to end up with the federal exchanges, and that actually may be a good thing. There may be economies of scale there. Rather than having an exchange replicated 8 or 10 times, there's just one federal exchange. It can be run more efficiently. Might it actually be a good thing that these Republican governors are saying, no, we're not going to do an exchange in our state? For the citizens of their state?
Well, I think it's an irony that we all need to get our heads around, right? That in some cases, I think the exchange that the federal government will facilitate in some states will have better consumer protections and probably better standards for health plans than you might see if the state were to put it together itself. So by those governors saying they don't want to play, they may actually be doing a good deed for the citizens of their states. And in some cases, there are some states that are very small, and running an exchange is going to be, probably isn't that much of a doable concern for them. And so having the ability to have that federal exchange that they can tap into, whether in partnership with the federal government or have the federal government do it itself, a state like Delaware or New Hampshire or someplace with a small population, that's probably going to be a good choice for them.
And yet, Ron, isn't there an incredible and almost delicious irony about a Republican governor saying, I don't want any federal takeover of my health care, damn it, so I'm going to turn this over to the feds.
Yeah, well, that's right. So you've got these conservative Republicans saying, I'm not going to do it. So they're saying, come on in, federal government. So there is this delicious irony. I would say, as Ethan was indicating to your previous question, the Affordable Care Act provides a real important foundation, but many very significant pieces of legislation created a foundation. Social Security. When the Social Security Act was passed in 1935, it didn't cover over half the women in the workforce. It didn't cover over 2/3 of the people of color in the workforce. Well, we fixed those things. Civil rights legislation took a long time to be implemented. I would say to you, the biggest challenge that we have now with respect to the Affordable Care Act, with respect to implementation, is we got tens of millions of people who don't have health coverage. And I just came back from a number of focus groups of people who are uninsured or recently were uninsured. And literally not a single person in the 4 focus groups that I saw in Philadelphia, and then there were focus groups in Columbus, Ohio, then in Miami, and tomorrow in San Antonio. Literally not a single person knew how the Affordable Care Act was going to affect their lives. So the big challenge for all of us and for the Obama administration is to create a big public education campaign.
So how is it going to affect their lives? If there's somebody watching the program right now who hasn't had insurance for the last X years and hasn't gone to the doctor because of it, or if they have, it's just been, they paid $100 out of pocket to get some eardrops or something, but that was it. How's this going to change their lives? Right?
It's very significant. So there are 2 different groups of folks. For those people who are middle class and moderate income, They're going to now be able to go to this new marketplace. There'll be lots of private insurance plans. They'll select one of those. And if they have income, say for a family of 3, of less than $75,000, they will get a tax credit subsidy to help pay for a portion of the premium. So they won't have as much of an out-of-pocket cost for those premiums.
And tax credit is an actual check from the government.
That's right. Yeah. So that's one group of people. The other group are low-income folks, people with incomes below 133% of poverty. For a family of 4, we're talking about roughly $30,000 in annual income. They will now be eligible to participate in the Medicaid program. The program will be expanded. However,
but some states are saying, some of these Republican governors are saying, we don't want your stinking Medicaid. I mean,
well, yes, you're right. However, in the first 3 years, in 2014, 15, and 16, the federal government will pick up 100% of the costs of those newly eligible. And thereafter, it diminishes somewhat, but it never goes below 90%. So there's an important lesson, by the way, with respect to the budget fight that's now taking place here in Washington. If the governors are going to opt into Medicaid, they're going to have to feel that the payment that the federal government is providing is reliable, that it's stable. And so there's a real important lesson for the folks who are going to be negotiating the budget. Don't cut the Medicaid program if you want to make sure that Obamacare truly reaches the people who that legislation...
Or for the Republicans who want to blow it up, be sure to cut Medicaid, because then we're going to, you know, it's going to be a very interesting one to keep track. Do you expect that battle is going to happen?
I do expect that battle is going to happen. I feel very confident the president is going to stand firm.
Let's hope so. More of tonight's bigger picture discussion, health care in America, right after this break.